you think about the challenges in the healthcare industry, usually people will always start with the cost of care. It is less expensive to care for a patient in their home than to incur the costs of a brick and mortar facility, whether it be a long-term care facility, an assisted living facility, an acute hospital, whatever that might be.
Consumer expectation has grown exponentially over the last 5 years. COVID definitely accelerated that. We have new patients that need products. We have cost pressures from everything from inflation to reimbursement pressures, reimbursement lagging inflation. Those are today's challenges that are going to be our challenges in 10 years.
When you think about at-home care, there are very few industries where you can say it's good for everybody. The payer, the health plan, it takes costs out of the system. The hospital system themselves, it creates capacity. And by the way, people like being in their home.
Many of these patients are getting home from the doctor, the hospital, and adjusting to a new adverse event or a chronic condition that they have to now manage. The last thing we want them to do is worry about their supplies, where it's coming from, is it going to be on time, to really take that one piece out of the concern. They have enough on their plate. We want to get them the right products at the right time.
So our ability to provide different types of care, whether it's helping enable a DME to provide the supplies that are needed to a patient's home, to our Edge Park side of a business, making sure a patient is getting their continuous glucose monitor to care for their diabetes on a regular basis, all the way to our new business of VeloCare, which is literally setting up hospital level care in the home. We are able to take some of the cost out of that system, which again is good for everybody, not even just in the home care system, but our population in general.
So it's really important that we're doing the right things today and investing to make sure that we're peeling the onion back and getting better in those areas over time, because cost is always going to be important. Transparency is going to be even more important in the future, and the expectations from patients is just going to grow.
So we have made a conscious effort to really invest in the long-term transformation of our distribution network, which has come in the form of new buildings, creating capacity and space to support our growth, but also in the technology we are putting inside the four walls of our buildings.
One of the examples of this is what's behind me, which is an AutoStore technology, which is a collection of robots that pick and pack medical supplies very rapidly, very efficiently, and very effectively.
When you sit in a warehouse like this and you get to see what we're doing every day and you understand that there's a person on the other end of that box, it's absolutely motivating to know that we have the honor and privilege to care for over 5 million patients on an annual basis and continuing to grow. So our ability to make sure that nutritional formula arrives on time, or if it's a patient that's in hospice care, right? It can't arrive a day late. It's too important. It has to be there on time. Those types of things are really the mission that we're trying to instill as a business and really part of our culture.